back to Antai Hospital's YouTube channel, and in today's topic we'd like to talk about male infertility. Now, why do we talk about male infertility first instead of beginning from female infertility? Is because male infertility is much more simpler to diagnose. The nature of cause is usually very few, less than 10. It's not as complicated as it is for female infertility, and we also want to always begin with male infertility when we do diagnosis. We don't want to begin with the female partner because it can take up several months of time because it's much more complicated. There's up to 150 individual causes for female infertility. And that's just the minimum amount. And then even if you have diagnosed something, you need to go for surgeries, and that will cost a lot of money as well. So that's why we always begin with the male partner first, because it's very easily diagnosed. We can do it within a day or two. Now, usually we can quickly do a sperm analysis, and that will just cost $100 to $200 in any clinic anywhere in the world, and we can immediately analyze what type of activity levels these sperm cells are, and then we can quickly diagnose you and then give you the relevant treatment. However, let's go into the classifications, because not all of these male factor infertility can be treated. That's why we begin with male infertility first, because it's simpler and we need to quickly determine whether or not it's treatable, and then we can give you an appropriate recommendation on how to proceed. So generally, when we talk about male infertility, there's two categories. One is a congenital factor, and the other one is a acquired factor. So congenital factor, with the most common form of a male infertility, most male infertility actually originates from this category, and I'd like to talk about is a chromosomal disorder. So if you have any problems with your sex chromosomes, then you will most likely suffer from this type of male factor infertility, and it's usually absolute, so it's not relative at all. It's difficult to treat, sometimes impossible to treat. Now, a few examples that I can mention is Turner syndrome, Klinefelter syndrome, and Down syndrome. All of these categories are male factor absolute infertility. There's no level of sperm being produced at all, and some of them do not even have gonads or testicles, and this is due to the presence of an extra chromosome or missing a chromosome. Now, this factor, male infertility, is untreatable. The next category of a congenital form of male factor infertility is azoospermia. Now, if you don't know what azoospermia means, it means that this person they have no chromosomal disorder at all. The genitalia has developed and matured properly. However, they are not producing any sperm at all. So either they are not producing any sperm at all, or they are producing very little, and this can be diagnosed using sperm analysis. And unfortunately for this type of patient as well, we cannot treat it. And if any other doctors recommends treatment, it's most likely a scam, so you need to be careful. For this category of patients, either you work it out with your partner, you decide not to have children, go for adoption, or you can quickly go into a divorce. Do not waste any more time on treatments, because these two are causing absolute infertility and it's untreatable. The next one that is rather hopeful is an acquired male factor infertility. Now, these types we can actually do some form of treatment, and most likely there is a high level of success rates as well. So the first form of acquired male infertility is hypospadias. Now, what this hypospadias means is that there is a problem with the urethra opening. So instead of it being on the tip of the penis, it's below the tip of the penis, it's underside or significantly lower as well. It could be in the scrotum. So when you engage in sexual intercourse, the sperm is not being ejaculated into the vaginal canal. It's usually outside the vaginal canal. And don't worry, if you are this type of condition, although it's quite rare, it's completely treatable. We just need to do a simple surgery to adjust the opening, and you can go on to cure this problem. Very effective treatment is available. The next one is premature ejaculation. Now, I'm sure you've heard of this. Premature ejaculation, erectile dysfunction. Usually, if you're not consuming too much alcohol, if you're not consuming too much tobacco products, Usually it's caused by mental factors, some form of depression, some form of anxiety or mental trauma that's affecting this, and this is also quite treatable. You can either go for medication to treat your depression if it's diagnosed to be depression, or you can go for our surgery here at Antai Hospital. For that factor, we do have a surgery known as selective dorsal neurectomy, where we can decrease the sensitivity of the penis, and you can last up to 45 minutes to an hour, and that surgery is available here at Antai Hospital. So if you are suffering from premature ejaculation, that's something that you can look into. If it's not mental factors related, then you can go for this surgery, only a 30-minute surgery, and you can experience the benefits. The next one is erectile dysfunction, very closely related to premature ejaculation. It's usually caused by consumption of too much bad food, smoking, drinking, or a combination of with mental factors as well. So you do need to seek counseling, therapy, medication, surgical treatment as well. This is in fact treatable, so that's a good news for people who are suffering from this category. So one important thing that we want you to pay attention to when you seek treatment for male factor infertility is, first of all, get diagnosed properly. And if it's in fact a congenital factor, like I mentioned earlier, do not waste any more time and money on treatment. You already know it doesn't work. So you have to discuss with your partner. Either you proceed, you go for IVF, assisted reproduction, IUI, surrogacy, adoption, or you end the marriage right there, because going for any form of treatment is not going to solve that. It's going to waste time and money. If you're diagnosed with acquired condition, so some form of damage to the testicles causing the low levels of sperm, or hypospadias, or ED, or premature ejaculation caused by mental factors, these are all actually treatable. So you need to know where you stand in the classifications. If it's congenital, don't seek for treatment anymore. If it's acquired, seek proper treatment at specialist hospitals. Now here at Antai Hospital, we do offer treatment for acquired male factor infertility. So I hope this video we've helped you understand the classifications, when to receive treatment, when to not waste time on treatments. And if you are interested in our services and products at Antai Hospital, please visit the website, get in touch with our consultants, and let's arrange a consultation or a visit to Antai Hospital to get yourself treated. Male factor infertility is not always treatable, but if you are in acquired male factor infertility, then you need to seek treatment as soon as possible. Now, hope you enjoyed this video and stay tuned to the next one.